name's Alexa Lopez. I'm a student physical therapist. Can I have your name and date of birth, please?
It's Shika Patel, March 13th, 1995.
Okay, Shika. So what we're doing here in this quiet area, just me and you one-on-one, we're going to go ahead and have an interview. And during this time, I'm just going to ask you some questions. We're going to have a casual conversation about what really brought you into physical therapy, okay?
Okay.
Great. So tell me, what's your chief complaint? What brought you here today?
I sprained my ankle.
Okay. Sprained your ankle. What side?
My left side.
Your left side? How old are you, Shika?
I'm 24.
24. All right. So what's your living arrangements?
I live at home with my parents.
All right. So did this happen at home, or where were you when this happened?
No, I was at the gym when it happened.
Okay. So at the gym, tell me a little bit about...
I was going for a box squat, and as I was coming off, I sprained my ankle.
Okay. First time that this has ever happened?
Yeah, I've never sprained my ankle before.
Okay. So did you take any, have you taken any medication or anything like that?
The first day I took some Tylenol, but I mainly have been sticking to ice, and I wrapping and just doing the rice technique of just resting and elevating.
Technique. She's got it good. She's been educated on this before, and this has never happened before.
No, this is the first time.
Okay. Did your parents ever have sprained ankles? Is that what they told you, how the good methods?
Actually, my dad's a physician, so yeah.
Okay. Oh, yeah, awesome. So, any family history of any issues in your family that you're aware of at all? And it could be irrelevant.
My grandma has heart disease.
Okay.
And my grandpa has diabetes.
Okay. So, okay, we got all that taste. So, tell me, so we were at the gym, and can you tell me a little bit more about exactly how your foot landed, and tell me the positioning, how it was?
So I came to jump down, and my ankle went this way.
Okay, so it kind of rolled inward. Oh gosh, that must have been really painful.
Yeah, it wasn't fun.
Yeah?
Yeah, it was pretty painful at the time.
Were you with a friend? Were they able to help you out?
I actually was at a boxing gym that I went, so it was a class, so
oh, no.
my coach was there, but it was good that they were there, and I just stayed there for a little bit. Yep, and then I went home afterwards, so I didn't continue doing anything after.
So on a scale of 0 to 10, 0 being no pain at all, you're able to walk out of here and jump around, 10 being the worst pain you've ever had, where was your pain at that time at the incident?
It was around a 7.
A 7? Okay, and where would you say your pain is at right now?
It's a 4.
A 4? And at its best since the incident happened, where would you say it was at that same scale?
Probably a 1.
Okay. So let's see. What do you do that kind of makes it go to that 1, that best level?
Icing, just resting, not being on it.
Okay. And what do you do that gets it at that worst pain scale? The worst.
Definitely
number?
walking on it or just using it.
So we're not able to do that yet. Okay. So were you using any assistant devices or anything like that, or have you just been?
No, I haven't needed to.
Okay.
Yeah.
Okay. So we said that this happened exactly how many days ago? Go ahead and reassure me. 7 days ago?
Yeah.
Okay. And since then, has it gotten better, worse, or do you think it's kind of been the same?
It's definitely gotten better.
It's definitely gotten better. Okay. So, like we said, it rolled inwards, and we said that it hurts the most. I just want to make sure I got this right. And you said it hurts the most when we're actually standing on it. Okay, cool. So let me go ahead and grab this paper that you have. So, in the beginning, before you came in, you filled out this paperwork, just the systems of review, and I don't see anything at all that's too much that we have to really talk about. I don't see any past surgeries, no past injuries, no illnesses really. No. Okay. And I don't see that you smoke, I don't see that you drink, no caffeine or anything like that.
No.
So you're a perfect patient.
Okay.
Great. So, with that said, kind of tell me, what are your goals that you want to get out of physical therapy?
I want to be able to go back to the gym, so I guess the first step is I want to be able to walk with no pain, and then eventually get back to the gym without any more injuries or anything like that. So I want to make sure it's back to the full strength before I try to work out again.
Yeah, definitely. Are you currently in school outside of the gym? What do you do with in your downtime?
I'm actually working right now as a scribe for
Okay.
a physician, yeah.
Okay.
So in the hospital.
For your dad, he got you the hookup?
Yeah.
Okay.
So I'm on my feet a lot, so that definitely aggravates it. So I've been like, I want to get back to work, but I've been taking some days off. Just the initial days I took off, I've been trying to go back, but
Okay.
yeah.
Got it. So that's definitely gonna hopefully happen here with physical therapy. So I'm gonna go ahead and take a better look at it. We're gonna go ahead and feel around now and see if there's anything that we can get a deeper look at, okay?
Okay, thank you.
Yeah. All right, so the next thing that we're gonna go ahead and take is your ankle brachial index. That's pretty much just assessing the blood flow to your lower extremities and making sure that it's adequate. So go ahead and put this cup around your arm. So I'm gonna go ahead and test this around both arms and both feet.
Okay.
With the ankle brachial index, I apply an ultrasound gel to allow myself to hear the pulsations of the brachial artery. I will blow up the cuff until I am unable to hear the pulsing no longer. Then I will slowly release, and the first pulse that I hear is the systolic pressure that I need in order to get my numbers for the test. As I am releasing the pressure, the first systolic sound that I hear is at exactly 114 on the right arm. Very good. On the patient's left arm, the first number that I saw for her systolic pressure was 112 exactly, making the right arm the highest number that I would use for both legs in the equation.
Okay.
Comfortable?
Mm-hmm.
Find your posterior tip. Okay. Very good. Ready?
Mm-hmm.
On the patient's right leg, the systolic pressure that I heard was at exactly 150, making the result for her right ABI at exactly 1.32, which falls under normal. Very good. On the patient's left leg, the systolic pressure was found at exactly 140, making the patient's left ABI at exactly 1.23, which is again in the normal range. So the next thing that we're going to go ahead and check is your heart auscultations. I'm going to be using this tool and just going ahead and pressing on different parts of your chest to hear your heart sounds, okay?
Okay.
You just go ahead and warm this up for you really quick. And let's go ahead and get started. During heart auscultations, I'm assessing the patient's rate, rhythm, and quality of her heart sounds, the S1 and S2, or the lub and the dub. I'm starting at the aortic valve, which sits in the second intercostal space on the right side. Then you will see me moving to the pulmonic valve, which sits in the second intercostal space on the patient's left side. The last two would be this tricuspid valve, which sits on the fifth intercostal space of the left side, and the final valve is called the mitral valve, which sits again in the fifth intercostal space, and it sits more laterally. 4, 5. Very good. And our last one right here, okay?
Mm-hmm.
Just gonna move this over just a little bit, same alignment. Very good. So the next thing that we're going to go ahead and do is check your lung auscultation.
Okay.
So I'm going to be using this tool, and we're just going to be touching different parts of your chest, and I'm going to be listening to the sound of your breathing.
Okay.
Let me go ahead and warm this up for you. It might be a little bit cold.
Okay.
And I'm going to ask you to take a deep inhale. I'm going to go ahead and palpate. Take a deep breath, and then when I hit to that next point, I'm just going to say next, okay?
Okay.
And go ahead, take a deep inhale. Very good. Next. Very good. Next. Next. During lung auscultations, I'm checking the quality of her breaths. For bronchotracheal sounds, it should be louder on the inspiration, and for her vesicular sounds, it should be louder on the expiration. But together, the bronchovesicular sounds are at a 1-to-1 ratio. Last one. I want to be careful and listen for abnormal sounds, such as crackles, which would be coarse and fine, wheezing, which would indicate narrowing of the smaller airways, stridors, which would be narrowing of the larger airways, or pleural rub.
Okay.
Checking lung auscultations on the patient's back, I want to start at the superior angle of the scapula. I will move to the opposite sides, going down on the medial borders of the scapula. My final points should end at the inferior angles of the scapula, bilaterally. Next. 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 Very good. Go ahead and get right underneath the scapula. Next. Good. Last one this side. And go ahead.